I know the one thing I keep wanting to bring up to you guys, and I hope it clarifies some things for someone. Maybe somebody's sick, and the doctors are constantly saying, well, you're fine. All of the medical, all your procedures and your lab work all come back fine. We don't see anything. Let me explain this to you. I'm not saying that doctors do not push for resolve and covering what your chief complaint is, because I want to think that most of them are in it for the right reason, because they care about mankind. Not money, but they care about mankind. But to be honest with you, if I said majority, I honestly don't think that would be a correct statement, especially in the 20th century. But okay, I'm explaining something to you, and that way, if you are someone who's sick and has to have procedures and lab work done, let's say you go to the doctor and he orders blood work, and he orders a CT scan. Let's just say a CT scan of your belly. All right, so first, it can be done with or without contrast. Contrast actually allows the radiologist to see, as that contrast moves through the body, how your body is responding to it, what it's doing in certain areas of your, let's just stick with stomach. So you have a radiologist who will take all the films, or no, they're not, it's all done on computer now, but they'll look at all of the photos or slides that the the x-ray technician took. And in so when he gives you a report on it, he's going to tell you, first of all, the things that he saw in his professional opinion. Okay, so if you take it to another radiologist, you're going to get a slightly different interpretation. But you may get right along, you may get the same impression, or it's called an impression, but that's exactly it. So that type of test is what we call subjective. Subjective meaning it is, however, the radiologist saw with his eyes and through his medical training as a radiologist. So his knowledge, what he's seen with his eyes, that's what you're going to get as the impression. The findings, he goes over everything with you, but the impression is the radiologist stating in his expert opinion, this is what he found. So because it is subjective, you could take that test to, I guarantee you, if you took that same test, the results of that CT scan of the abdomen, if you took it to 3 radiologists, you're going to get slightly different interpretations. And the CT test is only as good as the technician who is performing it. In other words, if you got a technician in there that doesn't care about their job, they don't care about anatomical alignment, how they position you before taking the test, because positioning, all that stuff, it really does make a difference. All right, so that's an example of subjective observation. Now, this has been always my theory, and I stand behind this, and that is not everybody in the radiologist class graduated at the top. There's always a top, and there's always a bottom. So, with that said, I'll have to take a detour again. With that said, and that goes with doctors. Well, radiologists, they really are doctors. But yeah, there's always a doctor who graduated. There's going to be one graduating at the top, one graduating at the bottom, and then you got all the folks in the middle. So when I go to a doctor, I want to know where he got his schooling, and and I'll ask him, and I'll tell him straight up, if this was your mom or your daughter or your wife, what would you do? Because that really puts them on the spot. All right, that's an example of subjective findings. All right, with lab work, that's objective, objective. So your hemoglobin, your hematocrit, your eosinophils, basophils, all of that stuff is objective. So it is what the machine says it is. But that can actually be under scrutiny as well. But for the most part, the number is what it says it is. Where it can be under scrutiny is this. What size needle did they use to draw your blood? How long did they have the blood in the syringe before they put it in the vial for analogy? So here's where in that aspect, lab work can be subjective, because every institution has their own way, and there's certain things that they go by to run the blood. They have different norms, but your basic baseline norms should be consistent everywhere. That was a bad accident. Sorry, guys. Oh, Lord, I pray that person's okay. So, if you get, let's say you or your loved one is sick and in the hospital, always ask them for a copy of your own records, or your loved one's records, and don't take no for an answer. If your symptoms are subjective, in other words, difference in symptoms being subjective and objective, okay, with a patient's symptoms. So subjective would be, I'm like a 10 on a 10 pain scale. That's subjective because that's how I feel. Or I'm a 5 out of 0 to 10 on the pain scale. That's subjective because that's my interpretation as to how I feel. Just because I'm a 10 on a 10 pain scale, though, does not mean that your next patient is going to always be a 10 on a 10. Is going to behave the same way you do on a 10 pain scale. They may be over there, bawling their eyes out and screaming in pain. And while patient so-and-so in the room next to them, they may be talking to you just like I'm making this video, and you wouldn't know that they were a 10 on a pain scale, because they are able to control, they have a high pain tolerance. So that's subjective. An objective symptom of a patient would be she has a gash on her head measuring let's just say measuring 6 centimeters long and 2 centimeters wide, and the tissue looks pink with no necrosis. That's an objective symptom that you can see. You can measure it for yourself, and you can state your objective. What you're seeing is, to the best of your ability as a trained professional, it is what it is. In other words, it's there. We can measure it. The measurements are all, that's all objective. So the reason I brought this up is because a lot of people go to the doctor. As soon as the doctor says, I don't see anything, or your test came back fine, but so I don't know, just come back to see me when it gets worse. If you got a doctor like that, fire him, because you don't want a doctor like that. You want a doctor that's going to treat you and your family as if it was his family. So I hope this helps everybody. I know I saw on Discord where Shamrock has her mother in the hospital, and so anyway, let's try to remember and keep her in our prayers. All right, guys, I love y'all. Bye bye.